Good morning, everyone. Welcome to today's episode of PYA's Healthcare Regulatory Roundup webinar series. Today's topic is Compliance Risk Assessments, Building Blocks for Your Annual Plan. PYA is happy to present today's webinar on this important topic. You may submit questions during the webinar by typing a message into the Q&A pane of the control panel. Also, immediately following the end of the webinar, you'll be asked to complete a short survey and submit any additional comments. Any questions posed during the webinar will be responded to via email after the webinar. We've posted a PDF copy of the presentation slides for your reference in the Resources pane. You can customize your viewing experience by resizing, moving, or minimizing all of the panes within the webinar.net platform. Also, you'll receive an email later today with a copy of the slides and a recording of the webinar. With that, I'd like to introduce our presenters, Shannon Sumner and Rhonda Buckholtz.
All right. Thank you, Jen. Well, good morning, everyone. We're really excited to cover this topic, and I think we have a pretty good crowd joining us today. I'm Shannon Sumner. I'm a principal with PYA. I am also the managing principal for our Nashville office, and I lead our regulatory compliance service line, focusing on compliance programs. We also serve as an independent review organization for entities that are under corporate integrity agreements. And we do a lot of auditing and monitoring on behalf of entities as well. And so joining me is Rhonda. Rhonda, good morning.
Hey, good morning, Shannon. I'm so happy to be here today. I've been in healthcare for a little over 35 years, and I had the pleasure of joining PYA back in March. And I've loved being able to work with our clients and provide services for them, especially around the risk assessments and those regulatory guidelines. So I'm happy to be here today. How about if we jump in?
Okay, let's do it.
Great. So on today's agenda, we're going to kind of go through the risk assessments of building that foundation of your compliance program and that successful risk assessment. We're going to kind of talk through risk identification and prioritizations. A lot of times we get overwhelmed on where do we start. We'll help talk you through those types of things. And then those risks that you should consider for your 2026 compliance work plan. And now's the time we should really be delving in and working on that. So we'll kind of dive into that. So let's start first with the building and the foundational blocks of those successful risk assessment programs. Compliance isn't just a regulatory requirement. It really serves as a not just only a legal requirement, but a critical component for us to be able to deliver safe and ethical and high quality care. That's really at the crux of what a compliance program is. We are heavily regulated in healthcare, and so we're tasked with navigating those complex webs of those federal and state laws, the payer requirements, industry standards. So that well-designed compliance program is going to help serve as both a shield and a guidance point for us along the way. I get asked a lot why compliance actually matters. And because we operate under intense scrutiny, we have patient data, potential for billing errors, risk of fraud and abuse, right? Those federal regulations that we have to also follow, Health Insurance Portability and Accountability Act, HIPAA, the False Claims Act, Anti-Kickback, all of those that are out there that place so many responsibilities on top of our healthcare organizations can lead to a lot of penalties and fines if we're not compliant. And so compliance is really important for us. And the why behind it becomes, we're not out there to set up rules just to make people follow rules. What we're trying to do is set up guardrails that keep our organizations safe from harm, our patients safe from harm, and be able to deliver that high quality of care. So the foundation at the root of our compliance programs, it starts with our leadership. senior executives, our board directors, our practice owners, all have to set the tone and really be visibly committed to compliance. We cannot have a thriving compliance plan if leadership views it as a check the box organization. So we must, as leadership, emphasize that compliance is that ethical obligation and a key driver for our success. So that includes appointing dedicated compliance officers or teams to oversee our programs and the implementation of those structures as well. And that's going to help ensure that our compliance efforts are centralized and coordinated and communicated across all of our departments. And if we don't have leadership that's going to help back us, those compliance initiatives then become underfunded or poorly executed, or quite honestly, even then just disregarded by staff. Oops, went back instead of forwards. In order for us to be successful, we have to make sure that we have a culture. And so building that culture of compliance means embedding ethical decision-making and regulatory awareness into our DNA. That's where we create that environment where we feel empowered to speak up about those potential violations, areas of concerns without feeling the fear of retaliation. And so open communication is really key. Employees need to feel heard. And so we need to make sure that we implement reporting mechanisms, our anonymous hotlines, digital reporting tools, anything that helps the staff be able to safely raise any compliance concerns. Make sure that we have regular training and education programs that's vital to reinforcing the importance of compliance and making sure that the employees absolutely understand the why behind what we're doing. And so a strong compliance culture, it doesn't happen overnight. It requires consistent reinforcement from leadership. And so once we start to integrate compliance objectives into performance evaluations and recognition of those employees who demonstrate ethical behavior, these efforts start to build time and trust and accountability, turning compliance from an obligation into that shared organizational value that we're all looking for. And so before we can build, we have to then kind of look at our risk. And so when we start to kind of take a look at what we're doing, we need to understand where our risks are coming from. And that's where these risk assessments can truly help us. They're going to help us identify areas where non-compliance is the most likely to occur. So it could be in billing and coding, patient privacy, referral arrangements, clinical documentation, right? It could be housed in a lot of different business areas. And so we want to make sure that our risk assessments are both comprehensive and dynamic to us. And so we have to kind of look at also external factors such as evolving regulations, payer policies, enforcement trends, as well as any internal factors, workflows, inefficiencies, outdated policies. And so by taking a good look at what's under the hood, we can then go back and revisit and update our risk assessments and make sure that our compliance efforts remain proactive rather than reactive, because we definitely want to be proactive in our compliance efforts. So once we kind of do all of that and we take that good look under the hood, then the findings from those risk assessments can help to guide us as the prioritization of our compliance activities. So those high risk areas, maybe we found some improper billing practices or some inadequate HIPAA safeguards. Those are the ones that we would address with more priority. And then we would kind of rank them down, and we'll kind of talk you through that as we go down through all of those types of things. Now, when we're talking about policies and procedures, those are the backbone of our compliance plan. But you have to keep in mind, you don't always need a policy for every single thing. Your policy should be well thought out and circle around where you have risk and those types of areas. Because remember, if you make 150 policies, you have to manage and regulate 150 policies. So you always want to be thoughtful, right? We don't want to have a policy just to have a policy. And so we translate those policies from those regulatory requirements into those then actionable steps that our employees can follow in their day-to-day work. So, right, it could look something like billing and coding guidelines that comply with our CMS and our commercial payer policies, HIPAA and privacy security protocols for protecting patient data, procedures for handling overpayments, refunds, our claim audits, maybe policies addressing Stark law and anti-kickback statutes in referral relationships, and then any standards for conducting internal audits and responding to government inquiries. We also have to keep in mind that when we set our policies and procedures, they have to be clear, easy to understand, and accessible to all of our employees. And so they need to be just practical and integrated onto our onboarding and our ongoing training as well. Which brings us to training and education, which is something that's always near and dear to my heart, because training is one of the most critical components of our compliance plan's foundation. If we do our risk assessments and we come up with our thoughtful policies and procedures, they don't serve us any good if we're not out educating our employees and making sure that everyone's aware of it. Because of the complexities that we work in, we need to make sure that everyone in their role understands what their part is in maintaining compliance. And so that effective training program is going to be continuous rather than just one time, right? So we want to see orientation sessions for new hires. That's going to cover our organizational policies, our code of conduct, right? And those key ones that are going to be important to that employee and the role that they're in. We want to have an annual refresher course or courses that are tailored to roles. Right? I want to have HIPAA privacy training for our clinical staff, coding compliance updates for our billing teams. I need to have scenario-based training that allows employees to practice identifying and responding to those compliance risks. And then training should also make sure that we document with attendance records, the training materials, and that we keep all of that for auditing purposes, right? So well-trained staff are much less likely to make costly errors and then report potential issues that we might run across. And so then we can move on to the auditing and monitoring. And so when we're talking about compliance plans and preparing for our risks, no plan is complete without mechanisms to measure its effectiveness. So that auditing and monitoring is going to help us to ensure that policies and procedures are being followed. And it's going to help us to then identify those areas where we might need to have opportunities for improvement, revising a policy or procedure, and those types of things. So our audits can take many forms. It could include a random review of medical records or billing claims, privacy safeguards. Monitoring activities could also involve automated tools that will help us then flag unusual billing patterns or periodic checks on adherence to the HIPAA regulations. Findings from audits and monitoring should feed directly into our corrective action plans then. So when we find issues, then we need to make sure that we act swiftly to correct the problem, to update the policy if that's needed, and then to retrain the staff. And sometimes that might be an individual staff member, or you identify a gap where it's actually going to require maybe retraining a larger group. And so that cycle of continuous improvement is what's going to help us be able to strengthen that overall compliance framework. The reporting and corrective actions is important to us for an effective compliance plan. That's going to help us vet out any suspected violations and help to implement those corrective measures. So employees should know how to be able to report those concerns, who's going to review them, and then how that follow-up is going to occur. And so those corrective actions could include revising policies, providing additional training, self-reporting to regulatory agencies when we find out that that's required as well. And we want to make sure that we have clear documentation of those corrective actions that's going to kind of demonstrate our commitment to compliance. And it's going to show those good faith efforts that we want to show to the government or others if we're ever investigated. We want to make sure that when we have corrective actions that do happen, that we use this as an opportunity to learn from them, but to also make sure that discipline is then centered fairly. And so, for example, if you have a policy that states, let's say a biller isn't allowed to change a code without a physician's permission, and say you have two billers that at the same time, when you're doing an audit, two billers both changed codes. One biller was terminated because they violated the policy, but one was retained. Where's your documentation that it was enforced adequately? And why was one retained, but one was let go? And so you want to make sure that you have the justification there to make sure that your policies are being enforced fairly, and that you can just kind of stand that up during review as well. And then we need to really start looking at sustaining your plan, because building a compliance plan is never a one-time project, right? What's risky to me this year might not be the same next year. We might have added new business lines, or we discontinued business lines. We might have added new specialties, right? There's a lot of things that happen. Payer policies might have been revised. So it's never a one-time project. It's actually a long-term evolving process. And so we have those healthcare laws, technologies that change, think AI and all of the technology changes that are happening now, telehealth expansion, our value-based care models, cybersecurity threats, all of these things that introduce new risks that require updated policies and controls. And so that ongoing communication with our staff and leadership, our external partners, help us to ensure that our compliance is actually a living, breathing part of our organization and our strategy. So those regular performance program evaluations, those can be conducted internally, or by a third-party expert to help identify those gaps and those opportunities for enhancement. So a well-built compliance plan is more than just a regulatory necessity. It's a strategic asset for healthcare organizations. So by establishing that strong foundation, that's going to be anchored in that leadership commitment, that culture of integrity that has clear policies, continuous training, proactive risk management. That's how we're going to be able to protect ourselves from both those legal and those financial pitfalls. That's going to help us then to also improve patient care. And so in this landscape where regulations are complex, penalties are high for missteps, that robust compliance plan is going to kind of give us a little bit of peace of mind. it's going to signal to our patients, to our payers, to our regulators that we are committed. Will we make mistakes? Most likely. We're human beings, but it shows our commitment to being able to do that. So if we have that solid foundation in place, healthcare organizations then can confidently navigate all of the challenges that we have, that then allow us to focus on what our missions really are, delivering that high quality patient centered care. And so sometimes planning fails. And, there's things that we can't always plan for. Shannon and I were talking about this yesterday. And so, sometimes we're kind of just moving along in our compliance world, and all of a sudden life happens. So we've done our due diligence, we've done our risk assessments, we've got this really robust plan, and then this happens. And so when we kind of look at that, right, we start to talk about what do we do when planning fails. And so, Shannon, I'm going to turn it over to you.
All right. Well, thank you so much. Yes, as we were talking about this earlier, when planning fails, they're actually replacing the HVAC units above my office today. So if you hear some banging, that's what's happening. So we're going to get into some of the nuts and bolts of probably why a lot of you are on this call related to, okay, now that Rhonda, you absolutely did a fantastic job of covering, all the elements from an effective compliance program and all the things. So you not only have the risk to sustaining your programmatic aspects that you just talked about, but also what are the risks that we need to be focused on from a compliance program perspective, from an auditing and monitoring and go forth. So one thing that I failed to mention in my background before coming back to the firm, oh goodness, a little over 12, 13, 14 years ago, I spent about 16 years in internal audit compliance. I was a compliance officer as well while the organization was under a corporate integrity agreement. So when you talk about when planning fails, you kind of have an apple cart turnover and you have to refocus, as many of you may know. But during that time, I spent at least 16 years doing compliance and internal audit risk assessment. So some of the things I want to share with you today are the lessons that I learned. But as Rhonda and I were actually preparing for this session, we recognize that not all of you are on the same spectrum. Small entities, in fact, we saw the attendee list. And so thank you all so very much for sharing your morning with us. But we have some smaller entities that may not have a defined compliance program, let alone a defined risk assessment methodology. We also have some of you attending that are very significantly large, like academic medical centers. You probably have an amazing toolkit resource for your risk assessments. But what we want to talk about today are some of those key building blocks to conducting that risk assessment. And one of the things that I wanted to mention is a lot of times we think about, well, what really is risk? And for those of you who are aware of the committee of the sponsoring organizations of the Treadway Commission, so really that's the COSO, that's the COSO framework. But COSO actually identifies risk and defines risk as the possibility that events will occur and affect the achievement of strategic and business objectives. One of the things that I learned in my prior life is it's so important to ensure that your compliance risk assessment, and for my internal audit friends that are on the call as well, kind of merging sometimes those two together, but you really need to ensure that your compliance work plan aligns with the strategic initiatives of the organization. Yes, we also have some basic block and tackling things that we have to do as recipients of federal healthcare dollars, but that is one of the things that always stuck with me is, yes, we do have these regulatory requirements, but we also have the strategic initiatives. And so we're going to talk a little bit about that as well. But for today, we're going to be covering, there's 6 key steps. There's identification of the risk universe. So really, particularly for those of you on the call that have very large systems, there's a lot to unpack there. What are some internal risks? What are external risks? Then how do we really start building that risk assessment inventory, scoring, prioritization? That's probably one of the questions I get a lot, because some can have, again, very complex risk assessment methodologies, but also my philosophy is you just don't want to get bogged down and sometimes in the mechanics of it. That's where if any of you have analysis paralysis, like sometimes I do, you can kind of get caught up in that and really lose sight of the overall objective. And then finally, related to documentation and continuous monitoring, as Rhonda talked about a little bit earlier. So related to the risk assessment, or excuse me, risk identification and prioritization, I really want to make sure that you all are aware of, I'm sure you probably are, but really ensure that you have this in your toolkit, are really 3 great resources that are available to us. Of course, the best one that we have from the OIG is their latest compliance program guidance. And if you all have that, I have it printed off here. Keep it here handy. It's probably got a little bit of coffee stains on it. But it also talks very much about compliance risk assessment, who's accountable for the risk assessment, should be conducted annually. I would say, just from my experience, it is a living, breathing document. If your compliance work plan looks the same at the end of the year as it did at the beginning of the year, you probably haven't done enough to evaluate that. It's always going to change, as we just know in the last few months of the things that have happened in the regulatory environment. And then the compliance committee should be responsible for conducting and implementing the compliance risk assessment. And we will talk about, who's involved in this process in just a moment. Great document. And then the second one is one that I really use all the time, whether we're doing compliance program assessments, whether we're doing any type of assistance to entities that might be facing any type of investigation. We really look at this document, and it's the U.S. Department of Justice Criminal Division's Evaluation of Corporate Compliance Program. So many of you are familiar with this. It was last updated in September of 2024. And it actually has a lot of expectations that they would place on any organization. So keep in mind, as you all know, this document it's kind of agnostic, related to whether it's healthcare or other types of entities, but any entities that receive types of federal program dollars. But within this document, this is something that I actually would recommend you present this to your compliance committees and think through, could we answer these questions? We have seen this firsthand whenever we've been involved in monitorships from a non-prosecution agreement standpoint, where we are helping the organization to respond. The government's going to ask those 3 fundamental questions. The first one is the corporation's compliance program well designed? This is where risk assessment really comes into play. Is it being applied earnestly and in good faith? In other words, is the program adequately resourced and empowered to function effectively? And does the corporation's compliance program work in practice? And within this particular document, there is a full section on risk assessment. And it does say that the starting point for the prosecutor's evaluation of whether the company has a well-designed program is how effective the risk assessment process is. In fact, it says they actually look at how the company has identified, assessed, and defined its risk profile, including specific factors that mitigate the company's risks and the degree to which the program devotes appropriate scrutiny on those risks. It also goes on to say that it's important that you evaluate your entity. And then before we started, Ron and I were chatting a little bit, and I love what you said, Rhonda, is that today we're going to be talking about risk. We're not talking about your risk, because all of you on the call have various different risks that are specific to your entities. But this actually does spend quite a bit of time in looking at root cause analysis. Are you utilizing some prior findings of other audits that are being performed? And we're going to cover that in just a moment. So I'm going to come back to this. And then finally, a document that it's pretty intense, I will say. But I think it's a really good, if you all haven't, and there's actually a link. So if you go to your OIG compliance program guidance and look at the links, if you go to the risk assessment section, and I think that's actually it starts on page 56. And within that section, there's actually a link to the COSO document. And this was actually created in 2020. And it was a partnership between Society of Corporate Compliance and Ethics and Healthcare Compliance Association. And the topic of it is enterprise risk management, compliance risk management, applying the COSO ERM framework. So this is a very good document to look at, because it gives you some guidance for each element of your compliance programs, but also very specific key principles related to identification, prioritization of risk, and integrating that in your compliance program. So if you haven't done that, it kind of looks like this document here. Well, camera, there you go. So I would strongly recommend that you take a look at that. In fact, Rhonda and I, again, when we were preparing for this, would love to get everyone's feedback at the end of this session. There's actually going to be a mechanism to seek your feedback. We're thinking about turning this into, instead of just kind of a one and done related to risk assessment, but maybe turning this into a series of webinars or even compliance roundtables, maybe a fireside chat for each of these different elements, and utilizing some of this guidance determination of, how can we certainly take this information and utilize it in our organizations. So that was my commercial break for those 3 documents. So the next relates to, the actual purpose of conducting, the purpose of the risk identification and prioritization. This is really where you are creating that first step. It's understanding your risk universe. Again, the guidance gives some great references and resources, but when you think about your entities, that's part of your risk universe. The first thing is really looking at your, your entities, and that can be very complex for those of you who have very large health systems, multiple disciplinary programs and services. But the first thing is understanding your entities and getting a list of those, particularly your legal entities, your joint ventures, your partnerships. As you think through, who are we doing business with? That has certainly grown, certainly since I was actually practicing in internal audit. But joint ventures, partnerships, any significant or large contracts with third parties. And in fact, kind of going back to this Department of Justice document, there's actually a whole section on third party risk and vendor management. Is a whole nother webinar that we've done, and I think it's probably in some of our archives. But that's one that I would like to probably explore a little bit further with those of you on this call in a future webinar. But as more and more organizations are outsourcing either services or entering into relationships with third parties, and third parties can also be hidden in a variety of different areas. For many of you on this call who work very closely in the revenue cycle function, we also know that, third parties, there's a certain risk with that. Any of you that were involved in some of the Change Healthcare, the cyber event that happened earlier in the year, you'll certainly know the understanding and identification of risk as it relates to third party, particularly those third parties that might manage certain significant functions or be involved in certain significant functions for your organization. But again, the DOJ goes into also state that it's imperative for the compliance function to also be a part of understanding the merger and acquisitions, the due diligence being part of that process. So really that first step is understanding what are your entities that should be involved as part of your risk universe. The bullet point here that I'll really want to call attention to is the one that it says aligns compliance focus with the organization's strategic and operational goals. If you all don't have or have access to, as compliance professionals, your organization's strategic plan, I really encourage that, because again, as we talked about earlier, the key to risk, mitigation of risk, is mitigation of risk to the attainment of your organization's strategic and operational objectives. Again, you have some of the basic block and tackling, but are you aware of and are you involved in any significant decisions related to new service lines, new relationships with third parties, relationships with referral sources? Are you involved in that? And are you aware of how that will impact your compliance work plan? We also know that it's critical. You cannot audit everything. You cannot mitigate every single risk to your organization. The government in their publication, they're very clear about, we understand that you cannot address everything, but it is imperative that you at least prioritize so that, from a small entity, you may not have the significantly large budget to address some of those risks within the compliance function, but can you do some things within the compliance function? Are there other service areas that could assist you in mitigation of those risks? Because as we all know, it's not the compliance officer and compliance function's role to mitigate that risk. It is the entity's accountability to mitigate the risk. So the prioritization component is so important to do that. Plus, it also gives you a mechanism to elevate the areas that cannot be included on your work plan just because you just don't have those resources. And then it becomes the governance accountability and responsibility for that decision making. What are we willing to accept? I think this also goes hand in hand and really understanding your entity's risk appetite. And the COSO document that I just mentioned earlier has a whole section on documentation, evaluation, having that conversation about what is our organization's risk appetite. So the next step is what we're going to talk about relates to internal risks. So as we go through the kind of the risk assessment process related to internal risks, I think all of us are aware that there's so much data that our organizations are generating. There's so much data that our organizations have access to, whether it's your own internal data that you've generated or it's third parties that might be conducting audits of their own related to your claims and billing data, doing medical record reviews. There might be regulatory outside parties that provide that information back to you in terms of where they see your risk profile internally. So as you think through gathering the inventory of risk, again, the strategic objectives on your strategic plans, the data analysis that you're doing internally, within the DOJ guidance, they're very specific too, related to artificial intelligence. So if you haven't read that document, please be sure to do that because they specifically called out. It's imperative for organizations, and all of us on this call are impacted by artificial intelligence. What is the impact? Who's accountable in your organization to be aware of those risks, to monitor those risks, and how are you staying abreast of those risks as it relates to changes in your compliance work plan? So this just gives you kind of a laundry list of some of those internal risks. Again, we can add to that any mergers or acquisitions, any risks that have been identified as a result of due diligence. The DOJ document is also very, very clear on identification of risks during the due diligence process does not stop then. Once you bring on an entity, you have even that more, greater accountability to mitigation of those risks that have been identified. I'm going to date myself a little bit, Rhonda, but years and years and years ago, involved in a significant acquisition of another health system. When I was internal audit, part of the due diligence team, that's when we actually had the things that are on my bookshelf, the binders, we actually printed off paper and we put them in the 3-ring binders. And that was actually our due diligence work plan. Bless you all if you're still doing that. I will admit that I probably do a little bit of that as well. But again, if you're involved in due diligence, that's another risk that needs to be present on your compliance and or your internal audit or your risk management work plans, ensuring that those things that have been addressed do get mitigated. The next area of kind of your inventory of risks, external. We mentioned earlier, how can we have predicted some of the new regulatory changes this year? But there's been a lot, and there will continue to be a lot. The OIG work plan, the work plan is pretty active. So if you haven't taken a look at that, they're certainly focused on, telehealth, MA plans. There's just a whole host of other areas that could impact your particular organizations, program integrity reports, enforcement actions and settlements. I would strongly recommend as well to take a look and make sure that you are signed up for alerts from the Department of Justice, as also from the OIG, related to any type of program integrity settlements, whether they're corporate integrity agreements. Those are really great to review to see if you have any of those particular risks related to your specific industries, your specific organizations, and looking to see in terms of how those risks were elevated, how they were assessed, and through some of those settlement obligations, a little bit understanding in terms of the importance that certainly the government has placed on identification of those risks. Industry benchmarking, third-party reviews, accreditation. So these are those external factors that it's important for you to be taking an inventory, taking a look at those particular external risks. And then one area that is not on here, I want to make sure that we have to communicate this, is emerging technologies. Not just AI, but Internet of Things, all the things that are external sources that have access to your systems. It can be medical devices. It could be your electronic health records. It's a whole host of those external emerging technologies that need to be factored into your external risk inventory. So building that inventory. So once we start gathering this information and ensuring that we actually have start having that good risk inventory, what's a really good framework for developing that? So once that information is gathered, it's really considering that formal risk inventory or registry. So that's really that centralized list of those risks. And what we recommend is that for each of those risks, exactly, what could go wrong? What is the description of that risk? What's a regulatory reference? Specifically, is it a Stark Law citation? Where does this come from? What is the source of that particular requirement? And then also, has this been identified through maybe a hotline call? Is it just through our normal business practices? Is it that external agency that has, sent us a notice that we are maybe an outlier? So understanding a little bit of that source of risk. And I think that part is really important as well, is to see, is there something that popped up that we weren't aware of? Is it because we didn't have our right, communication protocols, whether internally to understand where that risk originated from, or are there specific maybe listservs or other types of communication memorandum that we need to make sure that we receive that information. Specifically, if you have, as we all know that many of you on this call are very complex organizations, understanding who's getting those transmittal, those memorandums. Sometimes it can come to the compliance function. Sometimes it can come to the various service line leaders. Just is there a way to capture some of that external information that's being shared with our health systems and our other types of health organizations? For those of you who have participated in these risk assessments, it can be a little bit of a challenge because you have so many different avenues, particularly for large organizations, of where this information can come through. So as you think through your risk inventory, to really take an exercise to think, where does all this information come from? And do we have a good way to stay on top of anything that's being sent our way? And then for a particular risk, is there as an assigned department owner or risk owner? And then what is that current status? So here's the risk. Here's my specific goals to identify the risk, to mitigate that risk, and to monitor that risk. And this is something that we talked about earlier, is really being that living, breathing document. It's just so important that is something that is part of your quarterly or quite frankly, maybe even a monthly review process if you have monthly compliance committees within your organization. I think this is a really good exercise to have really as a standing agenda item if you haven't considered that as yet. So risk scoring, I would say this is probably one of the areas that we get a lot of questions. And even when I was in internal audit and compliance, this is kind of where I got a little bit hung up. Don't make it overly complex. Now, if you do participate in enterprise risk management within your health systems, then this will probably be aligned with kind of your risk assessment, risk scoring methodology. But this is actually a pretty easy template to follow, and it can really be a simple scoring matrix. So for example, for each of the different areas, is it a high likelihood? Is it a high impact? Has there been a lot of regulatory scrutiny sensitivity surrounding this particular risk. How well is the organization ready for it? If you've had turnover, changes, growth of service lines, if you're very complex and you have processes are decentralized, then that can certainly elevate risk. And then reputational harm. I mean, first and foremost, quality of care. That should be, one of the certainly the main factors in termination of is this going to affect patient care and quality. And so just as an example, you could actually have each of these maybe on a scale of 1 to 5. And you could have a total score of 25 for a particular risk. And anything over, say, 15 to 20, 25 could be one of those things that have a higher risk than a lower risk. Again, there are so many risk assessment platforms that are available to you. We just wanted to give you just a high-level summary of what you can accomplish and not have a whole lot of maybe technology to support you. It's really having that great conversation with your compliance committee, with your risk management committees, to ensure that you have at least some level and some way of prioritizing risk. Again, kind of reflecting back on my prior history, we could have come up with probably 100 areas that we could have audited within internal audit, and there is no way possible. We did not have the resources. It's not an unlimited budget. So we actually had to use this as a mechanism to go to, at that point in time, the audit and compliance committee to say, we can only, within our internal resources, we've got 20 high risks. With our resources, we can truly only audit maybe 10, but of the 10 that's remaining, what is our risk profile? Are there things that we're willing to accept? Or are there areas that we either need to outsource to do that audit or provide more internal resources? I mean, it's as simple as that, to have those conversations. And I think that's where it's so imperative to have a really good risk scoring mechanism to do that. So just a couple of examples that we wanted to share with you, just taking a risk. HIPAA access log violations is one example. So what's that internal source? Is it IT department audit of system access logs? The issue is that multiple employees access charts of patients not under their care. The score, well, this is obviously a high likelihood, high impact, high regulatory scrutiny sensitivity. And then this is one, because of the high scoring, would require immediate policy review and maybe even a role-based review of access as well as staff re-education. One thing that I want to make sure that we also add to this is not just the action, but the action plan owner and due dates. I think it's important to have due dates so that you can start looking at, if we have a higher risk, but yet our due date to addressing that risk is 6 months within our organization's risk profile, that might not be acceptable. And if it is stretching to the 6-month mark, do we have accountability to kind of get that back on track? So as you think through your own documentation tools for assessing risk, as well as monitoring and mitigation of risk, ensure that you have the timing. I think that's critical. A lot of times you can read into an organization's kind of compliance culture if you have a lot of high impact, either past due issues, not started log that you can then present to the compliance committee, maybe even the compliance committee of the board. And so I think this will actually be some good tools for the compliance officers out there to stay on track with mitigation of those risk areas. And then we've just kind of got a couple of other areas, but because of time, I want to move on a little bit. So when you think about the different types of risks, there's certainly going to be, operational risk. We've got a variety of different buckets that we can categorize these. I would say that if you do participate within your organization in terms of your enterprise risk management function, to coordinate, there's certain nomenclature that you all might be using within your ERM function. If there's reputational risk, if there's business continuity risk, just really looking at, could you encapsulate those within those particular risk profiles and those risk silos as well. So just a couple of examples of operational risks. A lot of these should be on everyone's work plan, and we're going to talk about that in just a little bit. Another example, coding and billing risks examples, abuse and diagnosis coding, modifiers, medical device, vendors, just another little list of how you can also categorize some of those particular risk areas. This one I want to spend some time on. So who do we involve within the organization to help us assess risks? As I mentioned, the OIG guidance is extremely clear that it is not a compliance department, solely a compliance department activity. In fact, in the corporate integrity agreements that we have now, it is a specific expectation that the compliance committee is responsible for the risk assessment process. We have seen some organizations actually create a subcommittee of the compliance committee, because we know that there's other things that are on your work plans, but a subcommittee of the compliance committee that is tasked with the risk assessment process. So when you think about who to include in that, certainly, your clinical leadership, rev cycle, your billing teams, human resources, because I think it's important too, as you think through not only identification of risk, but addressing those risks within the HR function is important because of the training. If there's any particular documentation that needs to be created for those, if you think about your 7 elements of your compliance program, enforcement of disciplinary action, I think is critical here. IT and security, I can't even overstate this one from a cybersecurity perspective. Legal counsel, executive leadership. So think through your particular organizations, and when you think through some of the risks that are specific to you, who are those risk owners? Who could really help you as the compliance professionals to encapsulate all the risks that you have, at least the majority that you can identify, and involve them in that particular process? The OIG actually within their document goes on to state that the compliance committee should have compliance, audit, quality, and risk management functions coordinate to conduct a joint risk assessment. And we do see that for those of you who may be under corporate integrity agreements. When the OIG does evaluate your annual report, they may come on site. They do ask a lot of questions related to how are the various entities, groups within your organization collaborating together to identify compliance risks. There's very much spelling out those particular areas that I just mentioned. So again, for those of you who have been kind of doing risk assessments in a silo, now's the time to bring in the other, what we call internal assurance providers to help you with that particular process. This is an area, the documentation and continuous monitoring is actually noted in both the OIG's guidance as well as the Department of Justice guidance. They specifically call out how are you evaluating any type of risk event or adverse event from a root cause analysis. And that's important to continuously learn and continuously update your risk assessment methodology. Also through the tools that we mentioned, those email alerts, those industry publications, participation in compliance webinars and conferences, peer benchmarking, and regional collaborative networks. So there's just a whole host of resources that are available to you. As you think through also your risk assessment process, what you have, I think one of the number one policies that you should have, and it isn't probably one of the first policies that I ask for when we do a compliance assessment or risk assessment, is your documentation of your risk assessment methodology. Soup to nuts, beginning, how do you identify the things that we just talked about? How do you identify what is your risk universe? Who is involved in that? How do you determine what resources are you leveraging to assess your internal risks? Where is that source document? Where do they come from? Because it's so important to have that, particularly as you're starting to educate others within your department, and as you start working together on your compliance committee to identify and mitigate and monitor risks, it's really important to have a really good, strong risk assessment policy and procedure. So Rhonda, we talked about you can't have 150 policies, but that was probably one of the number one policies that I would recommend that all organizations should have. And then finally, wanted to throw this out there. Some risks to consider for your 2026 work plan. Again, we can't address all of your specific risks, but these are the ones that we hear over and over and over again, regardless of the size of your organization. Cybersecurity threats, data privacy, just some tips if you don't have on your compliance committee, and I'm also talking about the compliance committee of the board, as well as some of you who are on the call that may be part of boards. Who's your cybersecurity expert on that board? Who's your compliance expert on that board? For many of us who might have worked with back in the day of SOX or SOX Lite assessments, who's your financial expert in your audit committee? On your compliance committee, these should be some of your experts. Certainly the impacts of, I don't know how everyone says it, OBBA, OB cubed, I don't know, whatever everybody's calling it these days, but the impacts of that and any other future regulation. AI, we mentioned that earlier, and digital health technologies, these are just popping up like rabbits. All the different ways to access patient information, patient data, certainly patient-centric and virtual care models, remote patient monitoring, telemedicine, and the telehealth roller coaster I think that everyone is riding right now. Vendor and third-party risk management. I can't overstate this one, because actually that bullet point probably encapsulates probably most of the things that we have on here, actually. Quality of care. If you haven't seen, there are several quality of care corporate integrity agreements that are out there, certainly within the skilled nursing facilities, nursing homes. That's one area that is on the OIG work plan for the coming year. 340B program integrity. This is certainly the backbone of many of your organizations. And in fact, we've heard some organizations that if they lost their 340B program, they would have to shut down operations. If you do participate in a 340B program, ensuring that you are doing routine audits. The government is certainly very active now in looking at and ferreting out not just fraud, but waste and abuse, and ensuring that the 340B program is something that if you want to preserve, make sure you're doing that. And we only have 2 minutes. I can't open up the floor for what's on your work plan. But this last bullet point is here for a reason, because we would love to see if you all would be interested in a future, maybe it's a, I don't know, fireside chat. I think fireplaces will be firing up in the next couple of months. So maybe we really will have a fireside chat and talk about things that are on your work plan. What are you struggling with? What are, maybe some of your peers looking at? What should we be considering? What are the things that we want to think through from a compliance committee perspective too? So with that, I think we are almost at time. So Rhonda, before I conclude, anything that you wanted to mention to the group?
No, I think the risks that you went over, it's just important to stress. It's not a one size fits all. And, sometimes you might have a high risk area, but you're doing it really well. You're still going to want to keep that on your risk assessment and continue, because you have staffing changes or things change, right? Workflows. So it might become a lesser priority, but you're still going to, keep monitoring those and look at those types of things. There's a lot of moving parts for us right now.
Yeah, absolutely. So this was just one element of a compliance program. And we'd love to hear your perspective on other areas for future webinars. So we hope everyone has a great day. And we'll turn it back over, I think, to Jen.
Thanks to our presenters, Shannon and Rhonda. Please remember to stay on the line once the webinar disconnects to complete a short survey. Later today, you'll receive an email with their contact information and a recording of the webinar. Also, the slides and recordings for every episode of PYA's Healthcare Regulatory Roundup series are available in the Thought Leadership section of PYA's website, pyapc.com. While at our website, you may register for other PYA webinars and learn more about the full range of services offered by PYA. Please remember to stay on the line once the webinar disconnects to complete the short survey and post any additional questions you may have. On behalf of PYA, thank you for joining us. Have a great rest of your day.